second. Okay, again, we have the deltoid, and then we remove the deltoid. Now we have some muscles that surround the joint, or the shoulder joint, or the glenohumeral joints. Okay, what did we say? We said teres minor, infraspinatus, supraspinatus, subscapularis. Okay, these are the muscles of the shoulder joint, and let's hide them. Let's get rid of them here so that we know exactly the muscles from top to bottom here. Okay, now you can see what attaches here. Pectoralis major, and look, so many things attached to the humerus. Pectoralis major, hide. Okay, now let's go to the muscles that you guys hear in your ordinary day-to-day life. You can see biceps, triceps. Okay, let's go into the biceps. The biceps, it has long head, most lateral, short head, most medial. Let's hide the long head, and let's hide the short head. What's under it? What's under the biceps brachii? You have two things here. Brachialis, and you have this muscle, coracobrachialis. Okay? Brachialis and coracobrachialis. Hide them both. Now we have the, go ahead, ask me.
Yeah, could you please repeat these two last muscles?
Yes, brachialis right here, and
Yes.
coracobrachialis.
Coracobrachialis, thanks.
No problem. Brachialis and coracobrachialis. Now we have triceps. And for triceps, you have three things. Lateral head, hide. So triceps brachii, lateral head, most laterally, hide. Triceps brachii, long head. Okay, long head, hide. And finally, triceps brachii medius, hide. That's it. And this one is just a fascia. Don't worry about it. It's a tendon. Triceps brachii tendon. Okay. So again, triceps brachii, lateral, short, sorry, lateral, long, and medius. Lateral, long, and medius. Okay. What is this muscle here? Again, triceps, teres major. Okay, teres major, hide. This one here, latissimus dorsi. This is part of the back muscles. When you take back muscles, you will study trapezius, latissimus dorsi, okay, all of those things. But it's not part of the arm. Okay, but I wanted to show you all of the muscles surrounding your upper limb so that it's easy, you understand. See, even the back muscle right here is attached to the humerus. So now look, it's all of the muscles that we have discussed on the top part is gone. Let's go now to the forearm. What we discussed on the top is forearm, arm. Now forearm. Okay. Now, as I said, you have flexors, and then when we go back, extensors. Okay? Flexors and extensors. Why? Here. Extensors, they cause the hand to extend like this, or the fingers to help us shake someone's hand. They open up the fingers. The flexors, they cause movement like this of the hand, like this, or they close the fingers. Okay? So let's start with the flexor end. You have the flexor end here. The flexor end, 1, 2, 3, 4, 5. Okay, let's study them one by one. Now, I'm going to go from the most lateral to the most medial. Right here. Brachioradialis. Brachioradialis. Radialis because it's close to the radius. That's the radius. See? So here, the first flexor muscle that we have to know of the forearm is brachioradialis. Okay, let's see where. No. Let's see where it attaches and where it ends. See? Brachioradialis. It doesn't have anything to do with the hand. It ends here. See? It ends here. And inserts lateral part of styloid process of radius. And originates from distal lateral supracondylar ridge of humerus. That's the brachioradialis. So when you are, let's say, when you are looking at the pins, and let's say you're asked about this muscle, and you're confused. You can't get confused here if you know origin and insertion of this muscle. Boom, you go, you're like, okay, he points at this muscle. And you're allowed to see, where it starts and where it ends. So a hint for you, don't answer really quickly. Look and make sure. Oh, yes, it's attached to this place of the humerus. Then it attacks to this place of the radius. That's brachioradialis. Let's hide it. Okay, now look, we are still discussing the most superficial layer of flexor muscles. First one gone, brachioradialis. Now, pronator teres. Pronator teres. Let's isolate it. How does pronator teres extend? See, it doesn't even go into the wrist. Pronator teres. Okay, it originates from medial epicondyle of humerus, and it attaches on the radius. Distal, it says distal to the insertion of supinator. Supinator attaches here, pronator teres, and it doesn't go into the wrist. So now you know how unique brachioradialis is. Starts from here, ends here. Pronator teres after it attaches medial epicondyle and attaches on the lateral radius, distal, more distal from the attachment of supinator. So now you know how pronator teres is. So hide.
So pronator teres helps to rotate the radius in the
Yes,
ulnar radial.
exactly. You have here supinator and you have pronator. See, supinator, pronator, but supinator is more deeper. See, now if this contracts, of course, it will turn the radius this way. If this contracts, it will turn the radius this way. So supinator, pronator. But this one is called teres, pronator teres. This one is just called supinator. But supinator is way more deeper than pronator teres. Pronator is part of the superficial layer of the forearm flexors. Supinator is so deep. We don't even consider it part of anything. It's just supination, okay? So pronator teres. Hide. Now we have 3 more left. Flexor carpi radialis. And flexor carpi radialis, if we isolate it, look, we said its origination from the medial epicondyle of humerus, and it goes down. It doesn't go down here near the ulna. No, it goes and says hi to the radius. That's why flexor. Okay, that's why it's radialis. Okay, and it attaches close to the carpal bones. That's why carpi. And it's part of the flexor layer, or the flexor compartment of the forearm muscles. So flexor because of the flexion function. What it flexes what? Imagine if this contracts, this is attached here. So if this pulls, then the whole hand comes like this. If the whole hand flexes, not the finger, no, the whole hand. So flexor for flexing the hand, carpi for joining near the carpal bones, and radialis because it takes close to the radius. It chooses the radius side. Now, I hope this one is easy. So height. So far we have brachioradialis. Then we have pronator teres. Then we have flexor carpi radialis. Then we go on to the one we learned today. Isolate. Look what happens. It is long or called longus because there is a brevis. There is a brevis right here. This one is the longus. And for palmaris longus, palmaris, look, it takes so much surface area of the palm. And longus, it's just long. That's how I would remember it. So palmaris longus. Okay? It is originating from the medial epicondyle of the humerus and inserts into the palmar aponeurosis. So this aponeurosis right here, it's not part of the muscle. What it says is that it attaches into the palmar aponeurosis. So if your professor goes and tells you what's this muscle and you don't know, an easy hint is to know where it inserts. Boom. It inserts into the palmar aponeurosis. For your sake, just imagine this is part of the muscle and you're done. So palmaris longus, okay? Height. Now we have the last one. Because we had flexor carpi radialis, we shouldn't miss the sister. Flexor carpi ulnaris. Okay, isolate. Look. So look how big this one is. And sometimes people confuse it to be an extensor because it actually appears on the other side as well. Be careful, it doesn't. Because look, if this contracts, it's not attached here. It will not extend something. It's not extending, not the hand nor the fingers. If it contracts, look where it goes. Boom. Goes here. To flex something. To flex something. And it's attached, look, near the carpal bones. So what's its function? It reminds us of the flexor carpi radialis, which is attached here. When those two muscles contract, they cause the hand to shift this way. The whole hand, not the fingers, the whole hand. So flexor carpi ulnaris. Okay, flexor flexes the whole hand. Carpi because it's attached near the carpal bones. Ulnaris because it is choosing the side of ulna. There we go. Easy. That way we have finished the superficial layer of the flexor muscles of the forearm. All right, again, we have number one, brachioradialis that extends from here, the lateral side of the suprachondral ridge of the humerus, and attaches to the lateral end of the styloid. Brachioradialis. Second thing, pronator teres attaches from the medial epicondyle to the lateral end, to the lateral part of the radius distal to the attachment of the supinator, right here. Okay? Pronator teres. Number three, something related to the ulna. Flexor carpi radialis attaches somewhere here on the carpal bones and starts from here, medial epicondyle, to go together with the radius and attach near the carpal. So flexor to flex the hand, Carpi because it attaches near the carpal bones, and radialis because it chooses the side of radius. Then we have palmaris longus, which is attached to the aponeurosis, the palmar aponeurosis of the hand. And it also starts from here, medial epicondyle. Palmaris longus. Why longus? Because there is a brevis. Okay. Now, finally, flexor carpi ulnaris, from the medial epicondyle to the side close to the carpal bones, going along or choosing the side of the ulna. So flexor carpi ulnaris. So I hope the superficial muscles of the forearm are easy. Now we have one muscle in the middle layer, and we know what it is. Flexor digitorum superficialis. Now, flexor, it flexes something. Digitorum flexes the digits. Superficialis, because it's superficial to the deeper one, the profundus. Look, superficial to the deeper one, profundus. But we want to talk only about this one now.
I'm sorry, what is digits?
Digits is just another name for fingers. Yes, in
Okay.
English, sometimes you can, in science especially, you can call fingers or toes or anything digits. Okay,
Okay, thanks.
no problem. So isolate. Look what happens. This muscle you're looking at it now is the muscle that is found in the intermediate layer of the flexor muscles of the forearm. Okay, and look, it flexes something, the digits. So that's why flexor digitorum. And superficialis, why? Because it is superficial to something that is deeper to it here. And remember, those things here is for superficialis. And this hole right here is for the tendon of the profundus. Okay, now let's say an arm is injured here, somewhere here. The orthopedics comes to the patient and he tells him, please close your hand. And if he is able to close his hand, we know that the superficialis works. Okay, now the next step, should we stop here as orthopedic surgeons? No. What do? You have to check if another muscle deeper to that works. How do we do it? We check for the function of the profundus. And the profundus extends here and attaches here on the distal phalange of every digit in those four. Remember, the thumb is not part of it when we're talking about profundus or superficialis. Now, how to test for the function of profundus? You have to let the patient try to bend his distal phalange, okay, without bending his finger. And I think you know what I'm talking about. Sometimes you try to do that. Bend his distal phalange, which is this, without bending his whole finger. Is he able to? And you're able to really do it with your index the most. The rest of the fingers not much, but the index is, you have so much control over there. Okay, so that's why. So now when he points at this muscle and you really don't know what it is, just make sure to go and really check if he's pointing at profundus or superficialis. The superficialis ends like this. Deal. That's the intermediate layer. But let's look at the origin. Humero ulnar head. This is one head. This one is one head. Yes, I know it originates from three places, but they have or separate the origination into two heads for this muscle. The humeroulnar head and the radial head. The humeroulnar we will say that it originates from the medial epicondyle humerus, and you can say also the proximal end of the ulna, but it's not written here. And here, for the second head or the radial head, the middle third of the radius. That's the origination. Now the insertions, look, insertions, shafts of middle phalange of second to fifth digit. The first digit, which is the thumb, is not included. Second to fifth here. Second phalange. Deal? Okay, I hope it's clear. I know it'll really go a long way for you, because now we're breaking down one of the toughest things in anatomy, honestly. Hide.
By the way,
Yes.
why do we have like muscles colored in red, and these small things are white? Like,
These,
are they
these,
muscles or
these are the
just?
tendons of muscles.
Oh, it's tendons.
Yes, these are tendons. For example, look. See? Here. Tendon. And let's go to the biggest tendon of the body. See? Here. What's this tendon?
Yeah, but why do we have like heads colored in white of the muscles?
Because the muscle, in a way, it is life, but then when it goes to tendon, it's different material. Now when the tendon starts, because it's blending, the structure of the muscle it will start like this, but it needs some sort of very strong connective tissue called tendons to help them pull on muscle, on bones, you know. So that's why. Okay. So far, so clear.
Yeah.
Okay. Now, I don't know what this is. Wait. Yeah, fuck this. I don't care. Okay. Now we are in the deep layer. Okay. The deep layer, as we said, boom, made up of some muscles. Flexor digitorum profundus. Isolate. Look at this. That's the profundus. And I said when we check the function of profundus, we check if the distal phalange is able to move. That's how we check its function. Let's make a multiple selection. Watch. Where is it? How can I return it now? 1 second. If I do this, it'll be so bad. Okay, but you get the idea. The other one surrounded it like this, superficialis. This one is deeper to it. So this is the profundus. And the profundus is found in the deep layer of the flexor muscles of the forearm. Now, isolate here. Look. It originates posterior medial border of ulna. Posterior medial border of ulna. Inserts. Look. Distal phalanges. Second to fifth. Distal phalanges. The superficial middle phalanges. Okay? That's the difference. Now, what's its function? Of course, flexion of the fingers. Okay, to close the digits. Hide. The next one we want to talk about is this one, flexor pollicis longus. And here is the first time we talk about the thumb. The first time we talk about the thumb. The thumb is flexed. It has to be flexed, but it's not flexed by the superficialis or by the profundus. What is flexed by? Something that is found in the deep layer called the flexor pollicis longus. Flexor flexes something, pollicis the thumb, longus because it's long. We know now there is brevis. Okay, let's search for the brevis. But let's isolate this first. Look, see what I mean? Origin, interosseous membrane and anterior surface of radius. Insertion, the palmar side of distal phalanx. Palmar, which is close to the palm, distal phalanx. This is the distal phalanx. It flexes the thumb. Okay, hide. Okay, now I want to know Where is flexus pollicis brevis? I just want to know because I'm so triggered. There. Isolate. No, not hide. Isolate. There. See? That's flexor pollicis brevis. It's shorter. Flexus pollicis longus, from here, it went and it touched here, and it's part of the deepest layers of the flexor arms of the forearm. Of course, if there's longus, there's brevis, and we found it. Origin, flexor retinaculum. It has two heads, one and two. Flexor retinaculum, and the deep head, your deep head is from capitate and trapezium, and it inserts into the base of proximal phalange of the first digit. This is very specific, but you understand now. We just want the names now for just the pins, okay? So let's hide this one as well. We're done with them. Now, what's left for us in the muscles, in the flexor muscles of the forearm? Here. Boom. The deepest thing, pronator quadratus and supinator. Okay, hide this one and hide this one. Okay, now what's left for us? Extensor muscles and muscles of the hand. Extensor muscles. Look, same logic. We're going to move with this same logic. Extensor carpi radialis longus. Most superficial things. Extensor carpi radialis longus. Extensor extends. Carpi attached to the carpal bone area. Radialis because it chooses the side of the radius, and longus because it's long. Now we know there is a brevis. We will talk about it later. Isolate. Hide. We have radialis. We surely have ulnaris. Extensor carpi ulnaris. Isolate. Extensor extends something. Carpi attaches close to the carpal. Ulnaris chooses the side of the ulna. Together, extensor carpi ulnaris, extensor carpi radialis, ulnaris and radialis, when they contract, they extend the hand. Someone waves at you, you elevate your hand. So much of this action where your hand is raised is by the extension of these muscles. Ulnaris, radialis. Boom. Right. Now, this one, compared to the superficialis and the profundus on the flexor side, this one is found most superficial. So extensor digitorum of the hand. Isolate. Extensor digitorum of the hand. Again, thumb not involved. So always the thumb, it's flexed and extended separately. Extensor extends something, in this case the digits, the second to fifth, and digitorum because it's extending the digits of the hand. That's why extensor digitorum. And you can know the origin, lateral epicondyle insertion from 2 to 5th on what? Here. On the distal phalange. Okay. Let's hide it. Now, some smaller things are left, but one thing that we have to know and what we are looking for is the brevis. Maybe it's this. No, here. Yes. Extensor carpi radialis brevis is just under the longus. And here, in this case, there we go. Again, it's attached on the carpal. Also does the same function of longus. Right. Okay. Now, let's go into the more important things. This one, not important, but it exists. It's called the anconeus here. Okay, anconeus. Just know that it exists. And it's part of your pins, by the way. I've seen it. Anconeus. Okay. All right, let's hide it. Okay. This one, you guys remember. It's attached or goes directly to the small finger. So, of course, extensor, to extend something. Something as what? The small digit. Digiti minimum. Extensor, digiti minimum. See? Extensor, digiti minimum. Hide. Then we have here abductor pollicis longus. Now we know there is an abductor pollicis brevis. So abductor pollicis longus, boom, right here, attaches here. Abductor, it abducts the thumb, moves the thumb away from the hand. Pollicis, the thumb, longus because it's long. If I isolate, that's what it is. Abductor pollicis longus. Okay, let's hide it. If there is an abductor pollicis longus, there is an abductor pollicis brevis. There is an abductor pollicis brevis. Let's see what it is. No, no. Okay, where is it? I want to know. I'm so interested now. Abductor pollicis brevis. Okay, we'll search for it. But let's see. Let's finish the other finger. But remember, we have to find the abductor pollicis brevis. Okay. This one, extensor indices. Just like there is for the digiti minimi, there is for the indices. So let's hide it. Now, what's this? This is extensor pollicis longus. What's the difference between extensor pollicis longus and abductor pollicis longus? Look, extensor pollicis longus, it goes all the way to the distal phalange to extend the distal phalange or open the thumb. But the abductor pollicis longus, it attaches here. It only abducts the thumb. It moves it sideways, but this one opens it. Okay, isolate. Abductor pollicis longus. Extensor pollicis longus. Now we know we need to find two things: extensor pollicis brevis and abductor pollicis brevis. Right. What's this? We found one. Extensor pollicis brevis. Extensor pollicis longus attached here to open the thumb, and the brevis also helps open the thumb and also move it sideways. So here we found both extensor pollicis brevis and extensor pollicis longus. Height. Now I really want to know where the fuck is abductor pollicis brevis. Is this this one? There we go. This was part of the pins that we tested. Now we know we can connect the points. We have abductor pollicis longus to cause the thumb to move this way. Now there is abductor pollicis brevis, same exact function. Isolate. And it forms the some sort of bulge on your arm below your thumb. There's like a bulge. This is what it forms. So after isolating it, we hide it. Okay, now we're done with forearm. We're done with all the forearm muscles. And see, it's empty. It's good that we unlayer them to study them like that. I have less than a minute. I hope I can finish the hand after. But when it closes, just understand, okay? Now we have some muscles on the hand. First, here, palmaris brevis connects to what? Palmaris longus. Where did the palmaris longus was? On the superficial layer of the forearm muscles. Flexor part that was attached to the aponeurosis here. Palmaris brevis. Height. Okay, now we have those. Okay.
I'm ready.
Okay. Is Nastya ready?
Yeah, I am.
Okay. So for the first pin, we're gonna do this one right here. This name is for something else. It's not. Wait, let me see. Yes, here. So the first pin is this. And be careful. These muscles are confusing. Um, we'll learn them together. You will see. This one and this one are different. This one and this one are different. So the first one is here. Okay.
It's like palmar part, which is between.
Exactly. Okay. The next one is this muscle right here. Okay. The next one is, let's see, this one right here. This muscle that extends and has this triangle here. Okay. Okay. Next one. Yes. Next one is this one right here. Okay, 5 seconds, and we'll move on. Okay, the next one. Here. This one. Okay. The next one. Let's give me a second. Mm, Yes, the next one. Yes, this one right here. This one. Well, this is number 6. Number 7 is this one. Number 8 is this one. Number 9. Yes, number 9. This one. Number 10. This one. Number 11. This one right here. This one. Okay. Number 12. Either of those heads is fine, but this one is different than this. However, they're part of the same muscle. So that's number 12. Number 13. This one. Number 14. This one. Number 15. I need this small muscle right here. It's number 15. Number 16. I would need this one here. Right here. Then we have 17. I need these ones. This and this are different. So I need this first. Number 18, I need the other ones here. Okay. Number 19, I need this one. Number 20, I need this. So 19, 20. 19, 20. Okay. So quickly, before I begin, how was it?
We'll see.
Okay. All right. So the answers, number one, right here. You have to be careful. Look, for example, okay, it wasn't. Where is it? Where is it? Yes, I said for this one, it was this. Give me a second. So third palmar interosseous, and you can see second and then first. But then if you point at the other ones here, it's dorsal. Why? Why palmar and dorsal? Because look, here if you point at this one, it's closer to the palm. When you go to the back, you have ones on the dorsal end, of course, and that's why you have different names. So I pointed at the third palmar interosseous. Okay. How to know if it's palmar and dorsal? Palmar, it will be closer to the palm. Dorsal, it will be closer to the dorsal side of the hand. Okay. So that's number one. Number two, I said here, this muscle, supinator. Okay. This muscle is supinator. Number three, it's always nice for those forearm muscles, you know exactly what their endings are. So the one that has a palmar end like that, of course, it'll have palmaris in it. And that's why it's called palmaris longus. Okay? This muscle here is palmaris longus. Always forearm muscles, we have to know the endings to maybe give us an idea what it might be. So palmaris longus. The one after it, supraspinatus. Supraspinatus. Then I said I need this muscle right here, pronator quadratus. Okay. Then we have this muscle right here. No, here. Teres major, teres minor, infraspinatus. Teres major, teres minor, infraspinatus. And if you guys remember, we had these muscles control this joint. Remember when we wrote and said, oh, what muscles lie around the glenohumeral joint? We put them on the board, if you remember. Teres major, teres minor, infraspinatus, supraspinatus, and finally we said subscapularis. And that's one of the muscles or the pins that we have today. Okay, this one is subscapularis. Yeah.
I'm not sure if you mentioned about teres major, but I remember teres minor
Yes, so
in our orals about this joint.
yes, okay, you're right actually. It's teres minor, infraspinatus, subscapularis, and supraspinalis and subscapularis. Teres major, but also teres major, you see, it's actually attached to the humerus somehow. But you can see that teres minor goes up more and is attached on the head. But like you can see also major is involved in stabilizing the humerus because it has a humerus attachment. And it all lies in this region. Like the shoulder in a way is like fixated by those muscles. And remember this ligament? I told you coracoacromial ligament. It does not allow for the overflexion of the arm. Okay. But for our pins list, so it is number 6, number 7, number 8. Okay. And then number 9, we go to a different one. Just give me a second. Just give me a second. Okay. Um, what was this? It was, yeah, number 10. No, number 9. So number 9 was this. I had to increase this and this one here. No, not here. Sorry, I had to put this pin. I told you this one, but I wanted this. This is opponens pollicis. And for this one I pointed at, it is abductor pollicis brevis, but there's one under it, opponens pollicis. Okay. Opponens pollicis. That's number 9. Number 10, palmaris brevis. Number 11, we already looked at it. Subscapularis. And here, this muscle, let's isolate it. Look, where is it? Boom. Do you see it? It's attached on the costal surface of scapula. Subscapularis. Okay. Number 12, I said triceps brachii. Okay. But we just have to know when we study triceps that it has a lateral head and a long head. So triceps brachii. This one, number 13, pectoralis major. And the one under, number 14, pectoralis minor. Then we have this small muscle, subclavius. Subclavius, number 15, it's called subclavius because it's under the clavicle. Here, subclavius, attached to the first rib and the clavicle. Subclavius. Then I said I want this muscle, serratus anterior. This is a serratus anterior. Then for number 17, we said we wanted this muscle right here. It's the external intercostal. External intercostal. What does that mean? It's attached on the external edges of the intercostal rib cage. And for the other muscle, just after it, number 18, internal intercostal, and it's attached on the internal edges. We select them together and we isolate them. You can see that they cause a covering between the ribs. One is more externally and one is more internally. When you study this part of the ribs as well, you will come across a muscle that is also found. Just give me a second. Let me just deselect this. Yes, so you'll. Why is important is because you have to know. Yes, and then there's the innermost. So you have external, internal, and innermost. So this is the innermost. Then you have the internal, and then you have the external. Internal, and then external. When you study the muscles of the thoracic cage, you have to know those three, plus you have to know this one right here that looks like a spider, transverse thoracicus. And then those ones, levators costarum longi, okay? And I think here, subcostalis. So all of those make up muscles of the costal, the thoracic rib cage, okay? Just for your information. And then number 19, we said, number 19, we have flexor retinaculum. What is this? This is the floor. Yes, this is the floor of the carpal tunnel. So what is a carpal tunnel? If I isolate this, see, you have a carpal tunnel. This is the carpal tunnel here, carpal tunnel. This, what we have now for pin number 19, it's the floor of the carpal tunnel. The roof is made up of the carpal bones. Okay, and what passes through it, and you will study it soon, you have 9 ligaments and 8 ligaments and 1 median nerve, I think, yes. So this is very important. And then finally, you have this one, which is the extensor retinaculum. Okay, that's the extensor retinaculum. Okay, this is the end of our pins list for today. So how was it? Tell me.
For me, it was hard because I haven't learned about like the arm and thoracic cage.
Yes.
So that's why I'm learning only about the head now.
Nice. That's good. It's okay. But it's nice that with me, at least, like you're learning some stuff very quickly. I'll go again so that maybe you can memorize it. We have 7 minutes until this ends, and then I want to really dive into the arm with the pins so that it makes it easy for you. Okay, so the first pin again, here. See, you have a membrane such as the membrane between here. See, do you see this? Interosseous membrane, for example. And then you have some form of interosseous coverage on this edge. And this interosseous coverage of ligament that lies on the whole palm just reminds you of palmaris, okay? And then remember this long. So palmaris longus. The palmaris longus muscle in the forearm is part of the superficial muscles that exists on the forearm, and it has this at the end. It's very unique for it. So that's the first pin, okay? Palmaris longus. Then we have something that helps us, let's say, remember this one helps in supination, for example. So supinator, okay? This unique muscle that is found very deep is called the supinator. It's very easy. Okay. Oh, sorry. That I explained palmaris longus as number 1, but it's number 3. Sorry. The first pin was palmaris interosseus. Here. If we go in, third palmaris interosseus, second palmaris interosseus, and here, first palmaris, where is it? Just give me a second. Here, first palmaris interosseus. Okay, and why palmaris interosseus? Because it's near the palm, and interosseus, it's because it reminds us of the interosseous membrane here. That's why I referred to it, actually, I was confused. So interosseous membrane is the membrane between the two bones. And remember, when you want to mention this, it's like a muscle between two bones. So palmar interosseous, okay? That's the first pin. Second pin, supinator. Third, palmaris longus. Palmaris longus has this unique ending, and it's the only one, so we know it's palmaris longus. We have to memorize it. Then we have this pin here, supraspinatus. Why is supra? Why is it called supraspinatus? Because we have the spine here of the scapula, and if we isolate it, we see that it is on top of the spine. So supraspinatus. Easy. Next, we have pronator quadratus. Pronator quadratus. What does that mean? Pronator quadratus. I remember that quadratus because it has 4 sides, like a square, quadratus. 1, 2, 3, 4. So this one is pronator quadratus, okay? And it's one of the deepest muscles in the forearm. Pronator quadratus. Then we have here, it starts, just remember the muscles near this, what's it called? The scapula is attached to it. The teres major, teres minor, infraspinatus, supraspinatus. Supraspinatus, we just took it, infraspinatus below it, teres minor, teres major. Okay, so teres major, teres minor, infraspinatus, supraspinatus. All of those are attached to the which part? Let me see, I forgot. Isolate, and I take parts, are attached here. What was this? Yeah, infraspinatus fossa, exactly. So infraspinatus fossa, you have infraspinatus muscle, okay? And then the ones near to it that are attached to the angle here, or not to the angle, to the lateral surface, lateral border of the scapula, you have teres major, teres minor, easy. Okay. Then we have here, we went here and we checked. Now let's get all the muscles out. Now this is the hand, how it is. So you see there is a bump near your thumb. If you look at your hand, there is some sort of bump near your hand in this region here. The skin here is thick. So this one, the first muscle you meet is abductor pollicis brevis. Below it, opponens pollicis. That's it. Abductor pollicis brevis. What does it mean? Pollicis for the thumb, brevis short. Abductor, it means that it will push the thumb away from the hand. Push the thumb like this. So this is abductor pollicis brevis. And under it, directly, opponens pollicis, which is our 9th pin. Now, we have this one here. Palmaris. Anything in this region has a palmaris somehow. Okay? Palmaris longus, palmaris brevis. So look, longus and brevis. This is the long one. We always, if we hear palmaris longus, there is always a palmaris brevis, and it's here. Boom. Isolate. This is how it is. That's it. And if you're wondering which part of your hand is this, you see your pinky, go back a little bit, there is another bump on your hand in this region. It's because of the palmaris brevis. Palmaris brevis, the other bump here, abductor pollicis brevis. And that's it. So here, palmaris brevis, which is the other sister or brother for palmaris longus, okay? Then we have subscapularis, in the subscapular fossa of the scapula, right here. Subscapularis, easy, we know this one. Then we know all with this like very famous muscles, triceps, right? We have lateral head and long head. But this one, what I just wanted the triceps brachii. Then remember the muscles that many male bodybuilders are really good at to have this one, pectoralis